Happy evening to one and all. Um Welcome to all of you, first of all. Thank you very much for taking time and showing interest in attending the webinar with us today. Uh, During the course of this pandemic, COVID 2019, we have all lost so many people's life. It has made us make so many sacrifices, and it has shaken the entire world. We pray that all of us sail through this situation coming out stronger and healthier. A baby is a God's opinion that life should go on. So today we are going to be discussing about COVID-19 impacts on fertility and pregnancy. This webinar is sponsored by Fisart, fertility management software, created with the aim to seamlessly integrate doctor, patient, and hospital relationship to help achieve maximum success rates. We have with us panelists from Jananam Fertility Center, Chennai, that aims to provide the best treatment for couples to achieve their dream of parenthood. Welcome Dr. Vani, Dr. Mangalam, and Shajila. Dr. Vani is the Managing Director and Medical Director, DGO, MRN, and FRCOG. Shajila is the Chief Embryologist, and Dr. Mangalam is the Junior Fertility Specialist. So, welcome you all on board once again. So, today, let's start off with the before we start off with the webinar, I would like to say that these are segmented into different parts, and at the end of each segment, there would be a Q&A session. So you can raise your virtual hand and be ready with your questions by then. So let's move on to the session. Dr. Vani, what is this COVID? What are the symptoms and how does this spread? What is the mortality rate like? These are all things that are bothering us. Could you please answer this for us?
Thank you, Vasudha. Good evening, everybody. Can you hear me? You can hear me, everybody?
Yes, ma'am.
Okay. So I think we have a large audience today, and I'm sure you've been doing a lot of reading about COVID-19. So as an introduction, let me give you my 2 pennies worth. First of all, SARS-CoV-2 is the novel virus which produces an infection called COVID-19. SARS stands for Severe Acute Respiratory Syndrome, and CoV is coronavirus 2, COVID-2. And COVID is the infection which it causes, and it is coronavirus infectious diseases, and 19 is because the first case was isolated in Wuhan, China in December 2019. Now, SARS-CoV-2 belongs to a group of viruses called coronavirus. Now, these viruses have been known to be infectious to man for a very long period of time, but they usually produce mild respiratory illness, with the exception of 2 previous viruses, SARS-CoV and MERS, which is Middle Eastern Respiratory Syndrome. The thing about viruses is that viruses are very fragile organisms, and they need a host cell to actually survive and to multiply. Now, all of you have seen pictures of the coronavirus. The virus has spikes on the surface, and that's why it has the name corona, which means crown. So these spikes are actually protein, and they're called spike proteins, and they're able to attach to certain receptors on human cells. The receptor which binds to SARS-CoV-2 is called the ACE2 receptor. And the presence of that receptor, together with a protein called TMP-SSR2, both these are essential for the virus to get into the host cell. And once the virus enters the host cell, it begins to multiply, it damages the cells, it damages adjacent cells and produces infection. Now, there are certain organs in the body which have an abundant number of these receptors. One, the lungs. So it is predominantly a respiratory or a lung infection, the gastrointestinal tract, as well as the kidneys. So these are the organs which are mainly affected. Now, I'm sure all of you know the symptoms of COVID-19. It usually produces dry cough, extreme tiredness, and fever. And the other symptoms are nasal congestion, sneezing, body ache, loss of smell and loss of taste, and in severe cases, people can have difficulty breathing. Now, the important thing to understand is that 80% of people who actually have the virus are asymptomatic or have minimal symptoms. So sometimes they don't even know they're infected. About 15 in 100 will have symptoms severe enough to require oxygen. So they will need hospitalization, and 5 out of 100 will become critically ill and may need ventilation as well. And the people who are more likely to be critically ill are people who are older, greater than, say, 60 years, and people with underlying disease like hypertension, diabetes, cancer survivors, overweight, obese individuals. These are the people who are more likely to be critically ill. Okay. Now, we've had so many viral infections in the past. Why are we so concerned about SARS-CoV-2? Why are we talking about COVID-19? In what way is this virus different from other viruses? The first thing is this virus is very infectious. It is very contagious, and it can easily spread. One infected individual can actually infect 4 more individuals. And those 4 individuals will infect 4 people each. So it tends to spread very quickly and exponentially. And that's why it's become a pandemic. And all the way from China, the whole world has been affected with this infection. The second thing is the virus is relatively robust. So it's quite a strong and sturdy virus. And it survives in the air. It can survive in the air for up to 3 hours. On surfaces like plastic and stainless steel, it can survive for up to 72 hours, that's 3 days, and on cardboard for up to 24 hours. So if somebody touches an infected surface unknowingly and then transfers that virus to the mouth, eyes, or nose, they tend to get infected. So these are the 2 features about the virus which are very different from other viruses. But yet, there is some good news. The good news is that SARS-CoV, that is the first coronavirus, or the lethal coronavirus, killed 15 out of 100 infected people. MERS actually killed about 34 out of 100 infected people. And Ebola virus is very deadly. 50% of infected individuals can die. But with SARS-CoV-2, the death rate is actually not higher than 3.4%. And it, in fact, may be much, much lower because there are lots of people who do not have symptoms and who still carry the virus and may not have been detected or diagnosed. So in a nutshell, this is what I think is important for all of us to know about COVID-19. So that's my answer, Vasudha.
Thank you very much, Dr. Bani. It's such an explanatory answer in itself. I would like to ask why people are advised to be quarantined for about 14 days specifically.
Yes, 14. 14 is the kind of golden number these days. Why 14 days? Because when a virus infects a human, it takes some time for the virus to multiply. And it takes about 5 or 6 days for symptoms to show up. But sometimes the symptoms can be delayed up to 14 days. So that's the reason why we ask people to quarantine for 14 days. Now, quarantine means somebody who's exposed to the virus. Say they've been in contact with somebody who's had the viral infection, but they don't have the virus. They're asked to be separate or quarantined for 14 days to see if they develop the infection. This is different from self-isolation. Self-isolation means if somebody actually has the infection, and because you don't want them to spread it to anybody else, they're asked to self-isolate because their symptoms may not need hospitalization. And of course, another term which is commonly used these days is social distancing. So social distancing is actually maintaining at least a 1 meter distance between two individuals so as to prevent spread of infection through droplets, through sneezing or coughing. So that's the answer to quarantine for 14 days.
Okay, thank you, Dr. Vani. And Dr. Mangalam, I have a question
Yeah.
for you. So,
Yes.
what measures can be taken to boost my immunity and to prevent COVID, me getting affected by COVID?
Yes. Before I start with, I wish you all a very good evening. The question here is ways to boost one's immunity. So, if you think a particular food or supplement is going to boost your immunity, then I'm sorry to say that you're wrong. There is no single proven food or supplement that can boost a person's immunity. Certain nutrient deficiencies can impair our immune system. So we can take those as supplements so that our immune system can function normally. Supplements like vitamin C, vitamin D, zinc, they may help. And we can also include turmeric and ginger in our daily routine. We should adopt a healthy lifestyle and we should eat a balanced diet and we should be mindful of our weight too. Exercising is very important. We should have a routine actually. For those who have not been exercising earlier, I'd like to tell you all, please don't start with high intensity workout just because everybody says exercising is important. Start with something lower which will suit your body and then gradually you can move on to higher ones. So in what way exercise helps us? Exercising causes release of a hormone called endorphin. Endorphin can be called a happy hormone or a pleasure hormone. So it is positively related to one's mental well-being, I would say. So it is important that we should definitely spare some time of our day at least for exercise. Yoga and meditation, of course, helps. Obviously, we should have a sound sleep and we should remain well hydrated. And smoking needs to be quit completely. And please limit your alcohol intake. And during this time, it's not uncommon for someone to be in a state of, say, indecisiveness or anxiety or in depression. Please reach out to us for assistance in case if you find difficulty in coping with yourself. Stress by itself can lower a person's immunity. So please try not to be stressed. I know it's easier telling, but then it is we who should take measures to keep our spirits up and no other person can do that for us beyond an extent. But so these measures may, I emphasize, these measures may improve a person's immunity, but it really does not guarantee protection against contracting COVID. Social distancing is the only way out. So just because you're following all these, please don't skip social distancing. It's very important we all follow social distancing.
Thank you, Dr. Mangalam. That was very, very helpful. And I think we all must get our zinc levels, vitamin C, and all that level up, and a balanced diet and wonderful exercising. And Dr. Vani, what is this something about herd immunity? What is this thing? Could you
Right.
expand and let me know
Yes.
something
See,
more?
herd immunity is when 80 to 90% of the population is already infected. Now, what happens when somebody gets infected? After about 4 weeks, they have antibodies within their system. These antibodies prevent reinfection. So if 80 to 90% of the people had antibodies, then the virus will not be able to go from one person to the other because it will die because of the antibodies. So there will be no propagation of disease. So the disease just comes to an end and it perishes. Like, for example, we've eradicated smallpox. There is no smallpox. And how we've done it is by giving a vaccine. So basically, herd immunity can happen either by a vaccine. So everybody has antibodies after some time, and the virus does not propagate further, or the person gets infected, and then all the people get infected. So this is herd immunity. Herd immunity is a good thing because that will serve us to be protected in the course of time, but it may result in the loss of many lives because some people may develop critical disease and die in the process. But until the vaccine comes, I think herd immunity is probably a measure to gradually reduce this viral spread.
Okay, now we move on to the Q&A session. So I would request each and every one of you, the participants, to kindly raise your virtual hand so I would be able to take that question for you on behalf of you. Hello? Do we have any questions or hands raised as yet? Okay. Shall we move on? Yes, thank you. So now that we have discussed in general about COVID-19 and the current situation that is there, what about fertility, COVID, and us or you? So uh, you are a fertility specialist, Dr. Vani, and I would like to ask, is it the right time to start my fertility treatment?
Right.
I'm sorry. I see a hand raised. I think we will go to the question, if that's all right. I'm sorry.
That's
It's a
fine.
delayed question. Okay. Miss Nicola.
Hello,
Yes,
can you hear me?
Yes, we can hear you, Nicola.
Hello, good evening to you all. It's lovely to see you all. Good evening, Dr. Vani and Dr. Mangalam. It's lovely to see you.
Nice to see you, Nicola. Nice to hear you.
Oh no, it's very interesting. It's nice to hear all about COVID-19 from a different part of the world. Your views, etc. And to hear, and it's very good to hear. What you were saying is very similar to what we are hearing in the UK.
Yes.
Yes. Can I ask? One about the questions that really interests me is about boosting the immunity. I didn't quite hear. I heard vitamin C, vitamin D, zinc, turmeric, and ginger. Is that correct?
Taking all these yes, ma'am. Taking all these may help, but there is no proven evidence that everything actually helps. But there is no harm in taking. If somebody is already, if their immunity levels are impaired, then these things, supplementing these things do it actually helps.
Yeah, that's good. I mean, I'm getting a little bit paranoid about what I'm eating and my vitamin intake.
It's actually important that we increase vitamin C. I mean, taking vitamin C rich diet, it actually helps.
Yeah, Yeah, I heard vitamin C and vitamin D is particularly good for prevention against viruses generally.
Sorry, I couldn't hear well. Sorry.
That's okay. I have read before that taking vitamin C and vitamin D in large quantities is good to protect against viruses generally.
The recently, what the article says is only oxygen and paracetamol is helping in fighting COVID, which means if somebody acquires the disease, mean the infection, then therapeutically giving paracetamol and oxygen, only these two are proven to help. In fact. So we can take supplements, but we cannot be at ease just because we are taking those, and we cannot take things for granted that we'll definitely fight it against. So it involves many things. So if you're positive, then we can definitely fight against. We should take measures, protective measures as well.
Yeah. Yeah. No, I understand. I just whatever I can do to help, I think is good.
Yeah. Thanks for your question.
Thank you.
Yeah.
Thank you, Nicola.
My pleasure.
Yes. So Dr. Vani, so we'll move on to the next segment now. That's going to be talking about fertility, COVID, and you. So Dr. Vani, you are the fertility expert here. I would like to ask, is it the right time to be visiting my fertility specialist, or should I postpone my treatment in light of COVID 2019?
Thanks for that question, Vasudha. thing is that when the lockdown began all over the world, and when it was announced that this was a pandemic, many fertility centers closed. And this was because of two reasons. First, the resource staff were needed for important work, that is looking after the ICU and emergency. That was one reason. The second reason was that the actual effect of fertility treatment or the COVID on fertility treatment was not known at that point. But now, 6 months down the line, we've seen that fertility treatment actually is not affected by COVID. And now many centers are opened or they're opening. It really depends on how many cases there are in that particular area. But most of the centers are getting started. The thing is, regarding the reproductive tract, the receptors to take necessary steps to avoid getting infected, and we check his COVID status as well before we start treatment. So we're very careful. Now, if a couple happens to be, if the lady happens to be COVID positive, at any time during treatment, we will be forced to cancel the cycle until later. And if the man turns out to be COVID positive, then we don't use his sperm, but we freeze the eggs and then we fertilize the eggs later. So this is what we do. So fertility treatment.
Yes, thank you, Dr. Vani. And but is it safe to get pregnant right now?
Yes, see, I think actually there's going to be a baby boom in 10 months down the line, because there have been so many conceptions the world over because of this lockdown. Okay, so now we have evidence to tell us that a lady who is pregnant is not at greater risk of getting COVID infection. That's one thing. The second thing is, if a lady is pregnant and gets COVID infection, she's not at a greater risk of dying or becoming critically ill. That's the next thing we know. They behave just like non-pregnant individuals who get COVID. Now, there's an interesting study which was published very recently that involved 427 women, all pregnant, and all of them had COVID. And this study was done in the United Kingdom. And they found that certain risk factors, for example, if the mother was over 38 years, if she had diabetes or hypertension, if she was obese or overweight, then she had an increased risk of becoming critically ill. And critical illness occurred more commonly in the third trimester, that is after 28 weeks. Another very, very important finding in the study was that women who belong to BAME, that is Black, Asian, and ethnic minority groups in England, were more likely to become critically ill. And the one common factor in all these people, which they found, was all these women had low vitamin D levels. So we know we have some evidence to say that vitamin D deficiency can be linked to respiratory infections. So as Mangalam said, this is some more evidence to say that vitamin D needs to be supplemented in women who have vitamin D deficiency. So it's very important from this study. Another thing is regarding pregnancy is, which people need to know, is if they do get COVID infection, they have to drink plenty and keep themselves well hydrated and also move around, because pregnancy itself is a procoagulant state. So what does procoagulant mean? It means that the clotting tendency of blood increases during pregnancy. And this is for good reason, because after delivery, the patient quickly clots her blood and doesn't bleed excessively. So this is a preventive mechanism, a natural mechanism. Now, in COVID, once again, the clotting tendency of blood apparently increases. So in pregnancy, the woman has two factors if she gets COVID to increase the clotting of her blood, which is not a good thing. So pregnant women who are COVID positive must drink plenty of water, hydrate, keep themselves well hydrated, and also move around. And if the obstetrician thinks they are very high risk of getting clots, they may be advised blood thinning agents. So vitamin D and good hydration. Now, after 28 weeks, that's the risky time in the pregnancy. So women who are in their late pregnancy now, it is very important for them to adopt, to wear masks when they go for checkups, not to leave the house, to stay at home, and practice hygiene, like what has been stated, and social distancing. This is all very important because they must try their best not to catch the infection.
Okay, thank you, Dr. Vani. And Shajila, as an embryologist, would you be able to let me know if my eggs or embryos have a chance to get affected by this virus?
Okay, thank you, Asita. SARS-CoV-2, to invade any particular cell, needs to have receptors. ACE2 is one, and another protein which needs to be present is TMPSSR2. Both the ovary and the testis have negligible expression of both together. Also, the sperm and egg have no ACE2 receptors. SARS-CoV-2 cannot enter the egg and sperm. Therefore, from evidence occurred so far, the egg, sperm, and embryos are safe from COVID-19. Majority of the studies have found that the virus is not present in semen. Thank you.
Okay, that's the answer for the embryos and eggs. Okay, thank you, Shajila. So, Dr. Mangalam, suppose I've had a contact with a COVID-19 patient or somebody who has had COVID-19. How does that impact me, and how does that impact when I start my treatment?
Okay. Yeah, let me tell you. If you have had contact with a COVID positive patient, please remain on isolation for at least 14 days. At the end of 2 weeks, if you are fine COVID negative, then you can think about starting your treatment anytime. And if you have had COVID and you have recovered from that, then please take a month's time to improve your general condition. And for men who have had high temperatures, high fever as such can impair sperm production and sperm quality on a temporary note. So they can have at least 2 months break. So by the time they come for treatment, their profile and count and quality would definitely be better. So I think that would be the better way to go about it.
Okay, thank you. So we have a couple of questions for this session already from a couple of people here. I'm just going to read them out for you. So a question from Swati Sharma. We are thinking of planning for a family. Is it the good time or not? I'm a little worried for the baby.
I'll take that question, Vasudha. I think, yeah, this is the answer to Swati. I think it's okay, Swati, to go ahead. As I said, there are so many babies who've been conceived. In fact, some of our patients who are waiting for treatment conceived naturally at this time. So I think it's all right. The important thing to understand is that COVID-19 is going to be around for some time. So we have to take necessary precautions until the arrival of a vaccine, not to get infected if you're pregnant. So that's something you need to understand. And for anybody who's taking fertility treatment, we usually do an egg pickup in one particular month and the embryo transfer later. So we could always postpone the embryo transfer to later. But if you're talking about a natural pregnancy, there is no harm in trying at all. I told you the risk is a little greater after 28 weeks. And if you conceive now, by 28 weeks, we hopefully have a vaccine. So let's see. So I don't think that's a problem.
Okay. We have another anonymous question. Is it safe to freeze my eggs during the pandemic?
Yes, you can freeze your eggs. See, anything we do not do in a COVID positive person. So, as I said, if somebody needs egg freezing, we will check their COVID status on day 2, once again on day 10, make sure they're COVID negative, and then do the egg pickup. So, and there's no problem. As Shajila just mentioned, there are no receptors, COVID receptors on the eggs. There's nothing to worry whatsoever. So you could have egg freezing if you needed to.
Okay, and we have one more question for this segment. I am in the last trimester of my pregnancy. What are the precautions I should take?
Yes. So the first and the most important precaution is not to contract the infection. So you know how you should do that. Stay at home. If you don't need to go to the hospital, please don't. Do video consultations if it's necessary. And social distancing is very important. And of course, use masks when you go out and hand hygiene. These are the basic things. So if you're in your last trimester, don't panic. There's no need to panic. Most women sail through pregnancy beautifully and deliver babies without any harm. So don't panic. The important thing is focus all your energy and be focused about not getting the infection. That's the important thing. Make sure your vitamin D status is okay, and if you're vitamin D deficient, you need vitamin D and zinc and vitamin C, or, as Manglam said, and healthy food and a little bit of walking and exercise. That's all you need.
Okay. We have some more questions as well. So somebody has already completed course of vitamin D and have a transfer tomorrow. Is it required to take vitamin D again?
You don't need to have vitamin D again, but we can check your vitamin D levels, and if it's deficient, we can give you some more vitamin D. But if you've just completed a course, you should be fine.
Okay. Okay, thank you, Dr. Vani. So now we are going to be having a small break with Gomati and Ramesh, a couple who have just taken treatment during this pandemic from Jananam Fertility Center. Over to Gomati and Ramesh.
Hi,
Yes,
am I
sir.
audible?
Yes, ma'am. Thank you. How are you?
I'm good. I'm doing good. How are you?
I'm good too. Thank you.
Thank you. Yeah, so I've undergone a treatment. I would like to thank you, Dr. Vani, Manglam, and Sajila for treating me well. And I've taken a treatment at Jananam during May month, and at Jananam they precautionary measures like they and they keep the social distancing properly. They maintain it, and there is a proper hygienic thing, that factor that is maintained here. And before going to the hospital, I felt like I was wondering whether to take up the treatment now or not. Then I went to the hospital, and then I realized, and since everything is safe there, why not to take up the treatment now? Since we are already in lockdown, we can and work from home, and good care of myself. So that is why I've undergone a treatment during this lockdown especially, and I think I'm safe now. And after when I started my transfer, have to be under lockdown even if the lockdown is over. So you have to be under lockdown for until your pregnancy is over, so that since we have gone through all those initial struggles and a lot of things initially, and we have gone to this level, and to maintain this pregnancy safe and as it goes well, so we'll have to be in under lockdown. And I think it is better to be in the lockdown. So be at home and take care of ourselves. So that is how I'm doing now. And I've visited a couple of hospitals for various reasons. And here at Jananam, I feel it is safe to take up the treatment at this time also, since other hospitals, they don't maintain some normal things, like they'll not maintain the social distancing and the other stuff, but here it is strictly maintained. So I feel it is good to take up the treatment now.
Thank you very much, Gomati Ramesh. That was really sweet of you, and congratulations to the couple.
Thank you.
Yes. So now I think we just move on to a Fisart spot video.
Question. There are no more questions.
Okay, one second. I just a second. I think we have some more questions. So let me just take them if that's all right, Dr. Vani and
Yes.
Dr. Yeah. So I'm 8 weeks pregnant, Dr. Vani. Had said that if a pregnant woman tests positive, they have to be well hydrated and keep moving around. So would you like to take that question, Dr. Vani?
See, it's definitely, I just told you that COVID infection, if somebody is infected and if somebody is pregnant, their chance of forming clots within the blood vessels is increased. And so it's important for them to keep hydrated. So you drink 2.5 to 3 liters of water at least a day, and also move around, walk around. So that will prevent clot formation.
Okay.
Especially if you're pregnant.
Okay. So we have another question, Dr. Vani. Should as 8 spotting, is that okay?
Yeah, I mean, see, Sushma, if you have spotting, then it's important to see your obstetrician just to see what's going on. That has nothing to do with COVID, really. So when you do, it's probably better if you do a video call, explain your symptoms to the doctor, and if she thinks it's important for you to go into the hospital, please go in. Make sure that every consultation is absolutely required and a necessity before you venture out to hospitals. That way, single specialty hospitals are better because we have just fertility patients here, but a multi-specialty hospital will have all kinds of patients going in. And if you're visiting one such hospital, do not go unless it's absolutely necessary. Okay?
Okay. And I'd like to know how a pregnant COVID women will be treated.
See, pregnant COVID people are not going to be treated any differently. 80% of them will have minimal symptoms or be asymptomatic. And they probably will just need observation at home, or you can just self-isolate. The remaining 15 may need oxygen and they may need hospitalization. It's going to be just the same. And with women who are critically ill, it depends on which part of the pregnancy they are in, and depending on which part of the pregnancy, if they are in latter pregnancy, and if they need delivery, then that would be a decision made by their obstetrician. So there is no difference. And that's entirely in the hands of the COVID team, which should be done with the obstetrician and the COVID team in liaison with each other. So that's how it goes.
Okay, and one Ms. Swati, can you please elaborate on the ovulation cycle?
On the ovulation cycle? And is it ovulation cycle? Swati,
yes.
I didn't understand your question.
Okay, so I think we can skip this for now. Let's kind of move on to the next segment. Yes, so fertility, COVID, and the center. So, do you adopt any special cleaning techniques in the lab to prevent COVID now? Ms. Shajila?
Well, yes, we do. The first thing is we reduce the movement of staff to the laboratory. We encourage telephone communication between clinic and laboratory staff or patients. Since SARS-CoV-2 is transmitted through droplets that attaches to the surfaces, we remove the outer packaging of the products that we deliver from outside and wipe with safe disinfectant before taking them to IVF lab, because this virus can stay alive for 24 hours on shipping boxes. Then other thing is we use safe surface disinfectant to clean our IVF lab and theater surfaces. We also wipe our workstations with safe disinfectant, followed by distilled water after each procedure. The door handles, the pens we used in the laboratory also, we wipe with disinfectant regularly. Also, outside the IVF lab, we use sodium hypochlorite to clean the other areas of clinic, including floors, surfaces, tables and chairs repeatedly. We also restrict liquid nitrogen and gas cylinder suppliers to IVF lab premises.
Okay. Thank you, Shajila. That is very, very helpful, and that makes us a little bit more peaceful that we can visit fertility centers and be safe about visiting them for our treatments. And uh, Chinese scientists are suggesting that the virus may be transmitted sexually. Is that true, Dr. Vani?
Well, thanks, Vasudha. The thing is that, yes, there was a Chinese study which actually involved 50 men, and they were asked to give semen samples, and 15 of them couldn't. 38 of them did manage a semen sample, out of which 23 of them were recovering, and 2 of them had virus in their sperm, in their semen, not sperm. And out of the 15 who were quite seriously ill, 4 of them had virus in their semen. So a few of them who were recovering and a few of them who were seriously ill had the virus in the semen. But it does not mean that it is it can be a sexually transmitted disease, because for that to happen, the reproductive tract needs to have ACE2 receptors and the protein, which it does not have. So basically, when the person gets better and recovers completely, the virus will probably be absent in the semen. So though the virus was found in the semen, it does not mean that this is a sexually transmitted infection or disease.
Okay. And let me ask you another question, Dr. Vani. One from Mr. Bhaven Joshi. Does transfer advisable during the COVID period? I have 3 BB embryo. Is that good quality, and what is the chance?
Well, 3 BB is a good embryo. I can't tell you what the chances are, because that would depend really on multiple factors. Transfers, we do frozen embryo transfers, but what we do is we check the lady and make sure she's COVID negative just before the transfer. So if she was COVID positive, we would not transfer, we would delay transfer. Otherwise, transfer is fine. And once again, be safe and don't contract the infection. Take all necessary precautions. So that's the answer to that.
Okay, thank you, Dr. Vani. If I'm successful with the fertility treatment and I get pregnant and then catch COVID-19, am I putting my baby under risk?
Right. So this is the question regarding whether I can transmit the virus to the baby. That's what it means. Now, as far as studies have shown, the chance of this happening is very, very small. I was talking about the study involving 427 women published recently from the UK, and all of them were COVID positive, and in 6 of them, the babies had the virus within 12 hours of birth. But when they actually checked the amniotic fluid, they checked the cord blood, and they checked breast milk, there was no virus found. So it is still inconclusive as to whether the virus can be transmitted. But if there is viral transmission to the baby, that risk is supposed to be very, very low. So that's good news once again. The virus does not produce congenital anomalies or birth defects in the baby, and it does not increase the risk of miscarriage as well.
Do we have any more questions from the participants? I would like to see if anybody are willing to raise their virtual hand, so I can take some of your questions, please. Okay, we have some questions that have popped up in my chat. So there is an anonymous question, Dr. Vani. I have to go for donor IVF cycle. Is that safe to go for donor cycle right now, or should I wait till the COVID is over?
Okay. The thing is about donor cycles, unless we have a few patients who need egg donors quite quickly because their visas are expiring and they need to travel abroad, for them, it is a situation where I will look into getting an egg donor. But we must understand that egg donors may not be as committed to maintaining distance and staying at home as self-stimulation. So if I was getting stimulated, I would be very careful. If a donor was getting stimulated, she may be careful, she may not be careful. So of course we will check COVID, whether she's COVID positive or negative on day 2 of her cycle before stimulation. Once again on day 10, and if she's positive, we'll have to cancel the cycle. But perhaps, given that Chennai is a hotspot and there are lots and lots of cases right now here, given that, I would prefer to postpone donor cycles for the time being, if it's possible, until later, until things settle a little more. So that's the answer to that.
Okay. So I'm just, yeah. Okay. Okay, it's pretty much, I think some of the questions you have already covered it in the answers you've given in previous questions. So somebody has asked, is it necessary, they're planning to take their IVF cycle next month, and is it necessary for their husband to undergo for a COVID test before giving their sample?
Yes, usually when we do it is just before treatment. So on day 1 of the lady's period, or maybe a couple of days before, we ask the lady to have a COVID testing. So it's just ready for us before we start on day 2. And for the man, we could, depending on the semen sample, we advise testing on day 2 or on day 9 or day 10 on the day of the trigger, so that we can get a fresh sample from him to use for the injection during the IVF procedure. So that's how we usually plan it.
Okay, and we have one more question, Dr. Vani. What are the chances of natural conception in case of cervical stenosis? Could you please clarify?
Sorry, in case of cervical stenosis, natural conception?
Yeah, chances of
natural conception, the chance should be fairly good. But if you're not able to conceive, then you look at other reasons why you haven't conceived and talk to your obstetrician or the gynecologist and let them do a checkup and then tell you whether it's going to be possible or not.
Okay, thank you, Dr. Vani. So moving on, are we checking to see if the egg donor is at risk of being infected by COVID-19, Dr. Vani, from the center?
Because I just told you that egg donors, not the right time, not the best time to do egg donation, but yes, we take stringent precautions to check the egg donors.
From the center side, right? Yeah. So yeah, it depends on the center, to be precise. Do all of them check these things, or?
Well, I presume so, because we have guidelines from the ICMR, that is the Indian Council of Medical Research, telling us all what to do. And actually, they've advised against egg donor cycles for the current moment because of the increase in the number of cases. And I would really look into that seriously because of Chennai and this being such a hotspot and there being so many cases.
So Dr. Vani, what are the precautions that we are taking at our center to reduce this spread of this virus?
Yes, I think most hospitals are taking precautions now. See, there's 2 ways of looking at it. First is to prevent the spread in the hospital. The second thing is to keep the patient safe. So I will talk about how we take care of reducing spread. As soon as the patient walks in, we advise them to wash their hands, sanitize. We give them in-house slippers, which are sanitized regularly. So they remove their footwear and they wear the in-house slippers. And then we have a triage area where the temperature of every person is checked, every person, every couple, and then they're given a questionnaire. Now, this questionnaire is sent to their mobile phones, and it's very simple. They just fill it and send it back to us. Now, this questionnaire has questions regarding whether they have symptoms, whether they've been exposed to COVID patients, and also whether they've traveled from overseas recently and have been quarantined or not. So once they fill it in, and if we think they are triage negative or low risk, then they're advised to come upstairs. Seating, of course, is spaced. It's about 1 meter apart, and all the doors in the facility are kept open. So they don't have to touch any door and push it open, and therefore kind of maybe potentially infecting it. So all the doors are opened, and that's how we prevent spread within the hospital. And we, the consultation is from a distance, everything is from a distance. So that's how we do it.
Okay, fantastic, Dr. Vani. That is really good, because it's very important for us to know when we come to the center for a treatment that such standards and social distancing and cleanliness and hygiene are followed. Dr. Mangalam, how are you ensuring that I will not be contacting with a COVID-19 patient during the time of my appointment at the center? Would you be able to give me some light on that? I'm not able to hear you.
Is that okay?
Now? Yes, thank you.
Yeah, just give me a second. The question was how does someone avoid contracting COVID from us? As healthcare professionals, we have made quite a few changes in the way we handle patients. See, we take utmost care in protecting ourselves because nobody wants to take the coronavirus home. We protect ourselves in the best possible way we could, so that we try avoiding to be a threat or source of infection for our own family members and also to the patients who come trusting us. If staff of this hospital is getting a cough or fever, then we advise he or she to go on quarantine. And if that is a patient, then we prefer to do teleconsultation through Fisart, and Fisart had made that easier. Jananam as such is a standalone reproductive medicine unit. We don't have services for general medical problems. We see only patients who seek assistance for fertility. So all these factors, I think, they contribute to the reduction in the probability of our encounter with a person who may hold the virus. And coming to the precautions we take, each and every single employee of the hospital who steps in will have a temperature check on a daily basis. And we all wear N95 masks and we wear protective shield. We use hand sanitizer regularly, and we maintain social distancing between ourselves. And the important thing is, we have educated every single employee of this hospital, right from the person at the gate to the canteen people, the admin staffs, the hygiene workers. Everybody has been taught about the importance of maintaining these preventive measures, and we also constantly scrutinize them. And with regard to the patients, like we have scheduled appointments in such a way that we can avoid crowding in the waiting area, and the seating arrangements have also been changed. I feel COVID-19 can only be, someone can prevent from acquiring this infection only by two means. One is social distancing and wearing a mask. Everybody knows this. We all follow these, and we are very strict about it. And if a couple is willing to follow all these, then they can very well walk into our center.
Okay, thank you, Dr. Mangalam. And I think now we'll be moving back on to the Q&A sessions. So participants, those of you who have questions, kindly raise your hands. And yes, thank you. So we have some questions in the chat, and I also see some of them have raised their hands. I'm going to take some time and go through these questions. Yes. So an anonymous question, Dr. Vani,
Yes.
Because of this COVID situation, most of the doctors are limiting the number of visits. I actually called for an appointment after a month. Now I'm 18 weeks pregnant. Is it okay to consult in person after a month from now?
Yes, I think if you're 18 weeks and if everything has been going on fine, then it's fine to do it after 2 weeks, after 1 month. So you will be about 22 weeks, which is fine. I think it should be okay.
So I think I see some raised hands. I'm unable to click unmute the raised hand. I'm sorry for the hiccup. Just give me a second. Yes. Could you? Yes. I'm not able to see the hand raise. Okay, I think there is some problem in connecting the person who's raised their hand. I'm going to be just continuing with some of the questions that are here in my chat. So, yes. Sorry about the delay. I'm 35 years old. I had failed IVF last year. Is it safe now to go for IVF treatment again, or should I wait for some more time until the situation turns normal? Since we need to go to the hospital alternative days for injection and scan, is it advisable now?
Yes, okay. I think 35 years is a tricky age, and egg numbers start dropping after 35 years. So it's best not to wait very long and to get on with treatment. You can always have your embryo transfer later. But if IVF has failed once before, I don't know the reason why, but I think, as I said very clearly, fertility treatment is not a problem. The problem is staying away from COVID, and that you need to do very, very carefully. If you go to a single specialty hospital, the chance of you getting COVID from the hospital is going to be very small, but you need to take precautions. So I don't see any problem in getting on with treatment. And 35 is an age which you really need to look into your ovarian reserve and make sure that is okay before you take the option of waiting further.
Okay. Okay, thank you, Dr. Vani. I have a request. Those of you who have raised your hand, I request you to unmute yourselves before raising your hand. Yes. So we have another question, Dr. Vani. Also, is there a chance that COVID could spread from a nurse when they have put an injection and if they don't sanitize their hands, but do wear a mask?
Right. Okay, I think that's a very valid question. What nurses should do is, of course, we nurses here, they wear N95 masks, they wear a face shield. And before that, if a nurse has high temperature, or if she has tiredness, or if she has a sore throat or dry cough, she's not allowed to work. She's asked to self-isolate, quarantine. We get them checked and make sure they're COVID negative. And even in case they're COVID negative, they're actually asked to stay at home for 14 days. So that's the first thing, safety precaution 1. Second thing is that they wear N95 masks, as I said, and face shields. And of course, they have to change their gloves in between injections and sanitize. So that's supposed to be a routine. So with these precautions in place, I don't see how somebody can catch an infection unless the nurse herself is infected and has not been tested or is working with symptoms, which doesn't happen here. If a person has symptoms, they're quarantined. Even if they're negative, they stay quarantined for 14 days. So that precaution should be taken. So you will be safe.
Okay, thank you, Dr. Vani. And we have another anonymous person with a question. Bleeding before periods, is it related to endometriosis? Can you please let us know the chances of natural conception?
Well, that's difficult to answer because if you bleeding before periods can be due to endometriosis, it can be due to other causes as well. So the first thing to do is to actually go to a doctor and see what the problem is. And if it's a recurring problem, every month you have bleeding, abnormal bleeding, then we need to investigate the cause. And depending on what we find, only then we can tell you what your chances of normal conception are. So that's something which is a diagnosis to be made after you've been seen by a doctor.
Okay, thank you, Dr. Vani. Thank you, Dr. Mangalam and Shajila. So with this, we come to the end of this session and webinar today. I think we have covered pretty much from throwing light onto the COVID-19 to whether we can go in for IVF treatment right now and what are the precautionary measures and safety measures taken at the center. So this has been very, very insightful and helpful for so many couples in India and around the world, I'm sure, about giving some faith and that we could go to fertility centers and resume some treatment or start your treatment now. Thank you, Dr. Vani. Thank you, Shajila, and thank you, Dr. Mangalam. And I would also like to thank Janam Fertility Center and Fisart for sponsoring and conducting this webinar. Thank you, guys. This is me, Vasuda, signing off.